As of November 4, 725 positive COVID-19 patients, which is also equivalent to more than 90% of the active cases locally, were granted approval to remain in home isolation. According to Minister of Health Dr. Frank Anthony, who spoke with this newscast exclusively on Thursday, persons who test positive for the disease are presented with the option of either being isolated in a hospital or at their homes. Most of them have indicated that their homes are more comfortable. Dr. Anthony noted that the homes of patients approved for home isolation are assessed by the Ministry of Health surveillance team for the requisite amenities that would allow them to properly quarantine away from other relatives in the home. He informed that this category of patients experience mild to moderate symptoms of the virus and are frequently contacted by the surveillance team by way of phone to ensure that they are compliant with the rules. However, the minister highlighted that during the past month, there have been instances where persons who were supposed to be in home isolation were found to be out and about and interacting with the general public, putting them at risk of contracting the disease.
We had one case in particular where somebody who tested positive and then went into the public and was mingling with others and trying to deny that they're not positive. And when the medical personnel tried to remove him, was very resistant.
As a result, the COVID-19 emergency measures for the month of November entail provisions for home isolation violators to be prosecuted once found in breach of the stay-at-home order. Dr. Anthony opined that with the advent of optional home isolation, more persons have been coming forward to be tested for the virus.
If we have such cases, that we'll prosecute them. You know, we want to give people an option. I strongly believe, and we have some evidence to that effect, that when we had just one option of going into an institutional isolation, that a lot of people were not coming forward to be tested, and a lot of people didn't want to know. So you basically had cases that were going undetected.
The gazetted order issued on October 30 stipulates that any person who tests positive for the coronavirus shall not knowingly expose themselves without proper and necessary precautions against spreading the virus in any public place or to any person. Any person who contravenes this rule or facilitates a person in contravening the rule commits an offense and is liable on summary conviction to the penalty under Section 152 of the Public Health Ordinance. The Public Health Ordinance outlines a menu of measures the Ministry of Health can take to prevent persons from knowingly spreading the disease. The measures include removing patients to hospitals and providing curative treatment for those suffering from the disease. Patients in home isolation are required to isolate themselves for 10 days initially. If they are symptom-free at the end of the 10 days, they are given 3 additional days to segregate before being medically cleared of the coronavirus. Meanwhile, last month, Shadow Minister of Health Dr. Karen Cummins said the government's decision to have more than 800 positive persons in home isolation is contributing to the steep rise in cases. She posited that the government is saving billions of dollars by keeping those patients at home, but is failing to institute proper surveillance and support. Dr. Cummins is maintaining that non-hospitalized patients should be supported with care packages until their isolation period is over. Timeka Rodney reporting for the HGP Nightly News.